After learning to read the reports of RTView and Cirrus HDO cities, let's move on to understand what are the artifacts which can be present with OCT imagings. However, the optic nerve head map on the RTVSD-OCT of this patient shows RNFL thinning both inferiorly and superiorly. Here is another patient showing a glaucomatous optic disc with well demarcated superior nerve fibrillary defect with a correlating inferior arcuate defect on the visual field. The optic nerve head map of this eye, however, shows normal RNFL, but the GCC map shows GCC thinning at the macula. Another example of a glaucomatous eye showing inferior nerve fibrillary defect and an inferior neuroretinal rim thinning. However, the optic nerve head map shows normal RNFL in the corresponding inferior region. The GCC map, however, shows an inferior area of GCC thinning corresponding with the abnormality seen on the photograph. Artifacts are more common on the reference database classifications. However, the ONH and RNFL report of Cirrus HDOCT shows normal RNFL thickness in the deviation and the sector and clock R maps. So these are the maps which compare the RNFL thickness of the patient with an age-matched reference database. However, the RNFL thickness map shows the presence of the RNFL defect inferiorly. Another example of a glaucomatous eye showing RNFL defects superiorly and inferiorly with corresponding visual field defects inferiorly and a small nasal defect superiorly as well. The ONH and RNFL report of the Cirrus HDOCT shows RNFL thinning in the RNFL thickness map, both superiorly and inferiorly. However, the deviation and the clock hour and quadrant maps fail to pick up the RNFL defects seen on the clinical photograph. A relatively recent study evaluating the different maps on the ONH and RNFL report of Cirrus HDOCT found that the chance of missing a retinal nerve fiber layer defect found on optic disc photographs was maximum with the clock R maps and minimum or none with the RNFL thickness map. Artifacts are also commonly seen when the segmentation algorithm fails. The ONH and RNFL report of Cirrus HDOCT provides tomograms which tell us how the automated software has segmented the optic nerve head and the RNFL boundaries. The circular tomogram depicts how the anterior and posterior borders of the RNFL are demarcated by the automated software. And it becomes important to inspect the segmentation algorithm before going ahead with the interpretation of the scans. Here is an example of the segmentation algorithm failure in a GCA analysis scan. Once the segmentation algorithm is corrected with a repeat scan, we get more appropriate results.